All right.
Okay.
Hello, everyone. Welcome. I'm going to pull up our presentation, but welcome to Bridging the Gaps in Care. I am joined by Kenzie, the founder of Held in Hope, and we are so honored that you're here.
Yes,
Pull
thank you so
up.
much for having me, Lauren.
Absolutely, absolutely. We are so excited. If you guys saw what kind of prompted this whole thing was I had posted a reel and we it kind of went crazy viral and there were so many questions about the kit and what was in it, and we decided to, what, let's just host a event and unbox these kits and really show you guys what's inside and have a deeper discussion about how we can help bridge the gaps of miscarriage care together. So yeah, that's kind of why we're here and how we got started. Before we dive in, I just want to say welcome. Thank you so much for being here. Whether you yourself have experienced loss, whether you are a practitioner, a provider, a space holder of any kind for women navigating perinatal loss, we are just so honored that you're here. And truly, your presence here is really an act of courage, and it does help us and how we reshape and hold this space for grief. And so we just are so grateful that you're here to create a more compassionate, connected, and loss literate community with us. So just a little overview of what we will cover today. The flow, we will be going through our intros and who we are. We're going to discuss and identify a lot of gaps. We will do an unboxing of the Held and Hope kits. I will talk about practice changes and then we'll close with discussion and Q&A. So please use the chat. We ask that you stay muted during our presentation, and then we'll have time to unmute and discuss and answer any questions that you guys may have. So I'm going to turn it over to Kenzie.
Hi there. I am a co-founder of Held in Hope. We were established in October of 2022, and really it all developed because of a loss of my co-founder. And it was at that time her fifth loss. And I'd had a loss of my own, but it was through this conversation during that loss of there has to be something better. This can't be the best that there is. There has to be something better. So we explored that, and kind of discovered that there wasn't. And the conversation started with someone needs to create something to okay, I think we have to create something. So this has been what I've poured myself into for day in, day out for the last 5 years. And yeah, I'm grateful to be a part of this today. Sorry, I see you getting a drink there. Um, yeah. So, our mission is to support and equip women through first trimester pregnancy loss with comprehensive information, supplies, and compassion. And that's all in one kit. It works seamlessly with already established workflows. And in one box, a woman receives all of this information, these supplies, links to resources. And instead of leaving empty handed, she has all of this to take home with her. So when she lands in her own home, in her own space, it's all right there. And it really removes a lot of the guesswork of where do I even look for resources? I don't even remember what my doctor told me. I don't know what to expect. Instead of being alone with, Google in those moments, she has information, educational information, all of it right there in one place.
It's so beautiful. Thank you.
Yeah.
My name is Lolo Paz. I'm the founder of a Soulful Sorrow, and my background is more of a clinical background. I've been a nurse for the last 15 years. I have my master's in nursing. I'm board certified in critical care, and I'm also a trauma-informed yoga teacher. And that comes through a lot with what we offer at a Soulful Sorrow. We really are here to help women move through loss in a soulful way versus a silent or stigmatized way. We started in 2023, and our mission is powerful, and it's been ever evolving, but we exist to evolve the narrative and experience of loss from one that is taboo, coldly clinical, to one that is socially inclusive and sacredly approached with the gracious honor and reverence that this transformational experience deserves. Through compassionate community, holistic healing practices, and loss literacy education, we create a space where loss is met with dignity, understanding, and deep support. So, I have been in the medical field on both sides of the coin, both as a practitioner and also as a loss mom. And I have been searching for so many different ways to support lost moms. And when I found Held in Hope's kit, it was the first that I had found that was finally bridging the gap of, I feel like, the actual empowerment and educational tools that have been missing because a lot of the other kits, while wonderful and offer a lot of supportive tools like journals and candles and socks and things like that, there was no practical items. So I'm really excited to dive into what are in these kits. And I just want to say again, you guys are so courageous for being here. And thank you so much. And we just acknowledge that what we are going to talk about today might feel a little heavy, might feel a little bit triggering. And so we just invite you to take this at your own pace and, pay attention to your breathing. If you need to just drop in and be with yourself for a moment, if something's feeling a little triggering, go for it. So, I'm just going to start us off with just a little grounding moment before we dive in. So, I do this with our mamas inside our community space all the time. And this is something that you can even teach your clients or do yourself when you need a little moment. So, we do a little vagal nerve reset. So, with your head looking straight forward, staying still, you just move your eyeballs to the right and to the left very slowly. I call this eyeball yoga. And what you'll start to feel is this feeling that you want to take a deep breath or maybe a nice big yawn. And when you feel that calm come in, that's just your vagus nerve starting to calm down, putting us back into the rest and digest. We're here, we're present. There's nothing more that we need to do. Just sit and receive. And we'll take a couple deep breaths together. And together, we're going to breathe in courage. And we're going to exhale any expectations that we have of ourselves or of anything here. Two more times, breathing in more courage, exhaling any expectations. And one last time, nice big inhale, exhaling and letting go expectations or anything that doesn't serve us. So, just a quick little insight to my story. I know the pain of loss. I endured two back-to-back first trimester losses after a long 10 years of infertility and diagnoses and procedures. I had 24 total, which is just crazy. So both as a professional and now in the personal sense, really understanding the gaps that there are. It really took a toll on my mental health. I felt completely alone. I felt completely dismissed by my doctors, and it was really, really heartbreaking. And so that's really where the passion for this work comes from. So, real quick, let's talk about the landscape of loss. Well, I know a lot of us probably know this, so I'll go through this relatively quickly, the types of losses. We'll talk about prevalency and the gaps as well. So, first things first, loss is loss. Pregnancy loss is very vast and complex. No two experiences are alike, and they're very, very unique to each person. And how one person goes through a 12-week loss side by side, one woman can go through it completely different than the woman next to her. So there is no right or wrong way for somebody to process. But I think that when we begin to realize and recognize or pinpoint why this is such a complex and intense experience, it's that nuances aside, a mother has lost a child, a father has lost a child, and a family is fractured. So at the end of the day, loss is loss. So for our early losses, and this is really where a lot of these kits come into play. But this can be a complete miscarriage where the body naturally passes all the tissue. Incomplete miscarriage, meaning that the uterus retains some of that tissue and you may need help getting that out, whether it be by medication or DNC. Missed miscarriage, where the baby actually dies in the uterus, but mom has no symptoms. She's not sure. So this is when, you go in for your scan and they say, I'm so sorry, there's no heartbeat, and you had no idea. Right. So that's called a missed miscarriage. There's also something called blighted ovums, which there's an empty gestational sac where there's lack of a developing embryo in there. And then chemical pregnancies, where you have positive pregnancy test, but they're unable to detect a sac or any baby on ultrasound. And then our later losses, second and third trimester, complete late miscarriage. So similar to the early, but just occurs after that 12-week mark. And then similarly to the incomplete, where it's just happening later after that 12-week mark. And then similarly with the missed late miscarriage, where again, mamas don't know. They go in for their anatomy scan or their 16-week scan and things like that. And then of course there's stillbirth. So that's the loss of a baby after 20 weeks of gestation. And then there's other unique types of losses, and I know that I can't cover all of them here, but ectopic pregnancies, molar pregnancies, and TMFR pregnancies. So that just kind of gives us an overview of the types of loss that there are and people that we may serve. And the prevalence. So 1 in 4 pregnancies end in miscarriage. So that's not just 1 in 4 women, right? That's more. 1 in 4 pregnancies end in miscarriage. 1 in 8 couples face infertility, and 1 in 168 births result in stillbirth. So the actual number of miscarriages in the US may be higher because many times people don't realize that they're pregnant. And then 2.6 million babies are stillborn, half of whom die in childbirth. And so there is a lot of stigma and misconceptions still around perinatal loss. In a lot of these studies, they found that moms generally felt like they needed to be secretive about their loss because of the stigma. 60% of women reported feeling isolated due to the lack of open discussion like this happening about loss. And then Tommy's did a survey. 78% of women felt like a failure. 71% experienced guilt. And 41% felt that they had done something wrong. 28% felt ashamed. 41% felt alone. Sorry, just like reading that makes me emotional because I felt all those things. And so many women do. And I think that's why education and empowerment and conversations like this are so important so that women don't feel that way. And then there's a lot of misconceptions. There's, a lot of like sometimes religious beliefs or thinking that, oh, it was that stressful event, or it was that workout that I did, or it was that food that I ate, or, oh, I didn't know I was pregnant. I had a glass of wine. I mean, if you guys have been through it, you rack your brain of everything, thinking through like, what could I have changed? Okay. So moving into gaps. So postpartum care. So this is a big thing. Loss is loss. Loss is also birth, right? And so when a woman's pregnancy ends, she technically is in the postpartum period. And that is a huge shift that culturally needs to change in the perinatal umbrella. So starting to view these patients as postpartum patients because that's exactly what they are. But after you have a live birth, you're followed up, you're taking surveys, your mental health is being checked on. But women with loss actually don't even have any discussions about any type of postpartum care. 80% of people reported that healthcare providers did not discuss any postpartum care with them after loss. That is just, it's inexcusable. It's crazy. And 75% who miscarried did not receive any postpartum medical follow-up. So if you are a physician or you have say in this is a huge gap that you can help meet by starting to implement some of those same standards of care for live birth with loss, because mamas still need that support and those check-ins. And then 70% of people who miscarry cannot take time off work, often due to stigma or lack of employer support. Mental health, this is a huge gap that mamas are falling into all the time. Almost 30% meet the criteria for PTSD within a month of their loss. So that's pretty significant. Less than 20% of moms receive follow-up. And then 20% of women become symptomatic for depression or anxiety. And some of those symptoms can persist to 1 to 3 years, impacting quality of life and subsequent pregnancies. So this is really, really important. Another gap, which I feel like we're starting to make a little more headway, there's a little bit more discussion, but obviously 50% of DNA comes from dad, right? So there also is a lot of male factor when it comes to miscarriage, but women very much internalize it as like, this is my issue, this is my problem, I did something wrong, my body's broken, whatnot. So another thing to bring up into the conversation is actually sperm health and things like that. And we're getting more and more studies about that, which is really nice. So, you guys heard enough from me. I have a video that I'd like to play. These are real women from our community in a Soulful Sorrow who just share about what the word or the term miscarriage means to them, what it stirs up in them. And then later on, after Kenzie unboxes, we'll talk about different ways to actually approach trauma-informed language around loss. So hopefully this will play all right for us.
The word miscarriage to me means losing a piece of yourself. Hear the words miscarried. I hear blame on myself that something went wrong and something went amiss in my body. I feel like the word miscarriage implies that your body betrayed you and you lost both a pregnancy and a child. Is much more than just your baby. It's your identity a lot of times. It's what you thought your life was going to look like. It's everything. It shifts everything in your entire life. I experienced a missed miscarriage, and that made it feel even more as if I had done something wrong and I hadn't even known that something was wrong at the time. I racked my brain for every single thing I'd done since that positive pregnancy test to see if there was something I could have done to cause my loss. I'm a perinatal physio, so I logically know that there was nothing I had done wrong, but emotionally, it felt as if there must have been something. I kept searching for it because if I had done something, that at least I could not do that in the future, and maybe that would prevent me from experiencing loss. Unfortunately, my losses were dismissed by so many people who just simply didn't understand, even if they were really trying to help. My loss was dismissed by providers, family, and friends. I gave my friends and family grace because honestly, no one knows, and I pray they never have to, how one person feels during loss. I even know I have a hard time trying to express it to someone else still. However, I truly feel that providers should know better. The most hurtful thing that multiple people said to me after I experienced my loss was at least it was early, as if all of the plans and hopes that had started from the moment I started trying to conceive were worthless. And it made me feel as though I didn't have a right to grieve that loss because it was a first trimester loss. I had my first miscarriage with my son when I was 16 weeks pregnant. And then we got pregnant again and lost that baby at 6 weeks. And someone told me that it was for the better to have lost this one earlier because I didn't have as much of an opportunity to grow attached to the baby. But you love your baby so much the moment you find out you're pregnant. It doesn't hurt any less to lose a a baby at 6 weeks than it does to lose a baby at 16 weeks. You plan all of these things when you're pregnant about, what kind of sports they're going to play, what hobbies they might do. You think about who are they going to look like and what are they going to be like. That loss of, it's not just the loss of the child you're carrying, it's the future that you started to imagine for them, the excitement you were having about telling people in your life, and also the loss of being a mother. Each time I found out I'm pregnant, I have instantly felt like a mum, and you have that piece of your identity taken away from you. And I do think that it is massively the impact is massively underestimated.
I know that was a little dicey there with the audio. Hopefully you guys could also read the words on the screen. Very poignant words from women. So helping to bridge the gaps, and we'll dive into this a little deeper, but it's not just a medical event. All loss deserves compassion and validation. And we need the tools of education to really help bridge the gap. And that's why I'm so excited to have Kenzie unbox here in just a moment. So be the bridge. This is not just a heavy period. Offering supplies to help with passing the pregnancy at home is huge. Offering a 24/7 nurse or provider support for questions and concerns is huge. So implementing simple care changes, which we'll dive into next after Kenzie unboxes for us.
So I did bring a Health and Hope kit to unbox and go through. So this is, our kits are available on our website. Our kits are available on Amazon. If you are a provider, a church, a clinic, a midwife, anyone can have these kits in their facility, and also individuals can order in the event of a miscarriage. We ship every day. We ship overnight. Our our goal is just to get these to any woman experiencing loss so that she can be supported and equipped with one. So I'm going to back up a little bit here. This is a miscarriage kit, and I will show you what's inside. So when you open up the kit, right on top is our folder, and this has all of the information in it. And inside of the folder, we have the instruction card. So this walks the woman through step by step all the items in it and what their purpose is, why they were included, so that there's no guesswork. It starts as simple as when you start spotting, be sure the kit is in the bathroom with you. So it just removes all of that, all the questioning, because it walks you through. On the back side of this card, and this is something I never do show on our social media or anywhere else, but it does have the development, and it includes the approximate weight and size with a picture. It's not graphic, but it is informative, and this really helps women. We've heard a lot of great feedback about this. It really helps them to know what they're looking for. And it might be the first time they've ever even had to enter their mind that they're going to see this. There's a lot of trauma with not knowing that you very well could be seeing your baby, and having the knowledge that that could happen and that this is what you're looking for is just incredibly important. So that is on the back of the instruction card. And then we have our packet here. This is our information packet. It starts with just a letter from us to the mom, with just, we're really sorry that they're receiving this kit at all. We know that this is not what they hoped 4, and then it just breaks down what they're going to find inside. Um, and then it walks them through their options for miscarriage management, expectant management, medical management, surgical management. And everything is explained from just, a normal clinical perspective. And we kept this part, it's not emotional, it's not exactly graphic either. It's just pretty straightforward. From a normal clinical perspective, this is what each one of these is going to look like. So it walks through expectant management first, and then we have, and I can kind of skip through here, but medical management, and then medical management continued. And then we often say throughout the entire packet, consult with your provider about possible side effects, stay in communication with your provider. So that is encouraged throughout. But we also know that a lot of times women just are on their own with this. So that's why this information is so important. And then surgical management, what you can expect, because a woman might receive one of these while waiting for a DNC or while contemplating a DNC. And so we explain what that looks like. There's no option here that is pushed. We're not leaning one way or another. It's each woman deserves to be fully informed so she can make the best decision for herself, for her body, and all of that. So walking through the DNC, the surgical management, there's 2 pages on that. And then we have a when to call your healthcare provider page. And it just walks through any of that. But also, if you're concerned, always call. And then chromosomal testing. So as we talked about, women oftentimes are questioning, why did this happen? Did I do something wrong? And chromosomal testing can be sometimes the one thing that gives concrete clarity as to what happened. Why did this happen? And that can be peace giving, or knowledge, giving just knowledge to what happened in this constantly circulating loop we put ourselves through of questioning. So we talk about that here, chromosomal testing, and then here I'll kind of sit down here. Then there's handling babies' remains. So we did an update to our kit. Probably about 6 months ago to extend this part because as feedback was coming in, that was one of the parts that we were told is most powerful and that it was something that women didn't know would be so powerful maybe after the fact. They would come back and say that part, I wasn't ready for that part, and this was really helpful. So we extended it. So handling babies' remains. If you do find your baby, if you do pass your baby, what are the options like? And there's so much information that varies there, state by state. So where you can call your hospital, call your local funeral homes, because those are the places that are going to have that information. By law, they have to. And they might have an option to bury their baby. The hospitals often have programs where they can take their baby in and they can be part of a ceremony, a memorial ceremony. So this here goes over hospital burial programs. And again, please check with your state laws, speak with a legal or healthcare professional. So all that's in there. Yeah. Okay, so that's the really fast breakdown of the packet that's included in the folder. And then each one of our kits includes a memorial baby print. We had an artist make these for us, and we do have the 2 skin tone options. And this is the item that is just that they can hold on to, after everything and the world moves on and you feel like my arms are empty, just something to hold on to. And then carried for a moment, love for a lifetime is on the back of those. And then we have just this sheet here, which starts with our disclaimer, and then right here, a link to resources if they want to donate, a link to our social media page, and then we do encourage feedback should they want to give that to us. But the resources are here. You scan the QR code and it takes you to our page filled with incredible resources for after loss. And then we updated this recently too to also have the QR code here. So an extra place that points them to after loss resources. And then the items in our kit, it looks like, let's see if I can do this gracefully. This is kind of, well, there were pictures too, but this is a kit. It's all kind of laid out here. So we have our medical supply bag. This has 2 maxi pads, a peri bottle, 2 sets of gloves, and a bag marked for placenta. Should she find her placenta or be able to separate that, she can turn that in then to her hospital for testing. We have our heart bag, and this includes a little jar inside with a saline tablet and instructions. So you fill this with water, enter this, pour in the saline, and then should she find baby, the saline acts as a preservative in here. And she can turn this into her hospital for testing, or she can turn this into her funeral home, her hospital for a burial program, anything like that. And because it is to be kept in the refrigerator, we have a heart bag to, keep it in there. Yeah, and incredibly, I mean, I feel that every component is so important, but this one has been, we've received a lot of feedback. Again, just something that you haven't maybe thought about. And instead of digging through your Tupperware drawer, she can have this. And then we created a grief journal, miscarriage grief journal. It has prompts inside. So when she is in the moment, she can jot those down, but we encourage her then to include, what do you want to remember? What questions do you have for your healthcare provider? How are you feeling physically? How are you feeling emotionally? A, a designated space to put this, because it's a very, it's a shifting thing. How you're feeling in that moment, can change, and you might, in the emotion of it, you may forget really important things that you need to, might need to talk to your doctor about. So everyone includes one of these, and we tried really hard to make it lovely while being, practical. And then we just included little gummies. We have our lip balm. And then we have a little candle in here that says forever loved, forever remembered on top there. So, oh, and then on the bottom, kind of under the crinkle paper, I'll lean over and grab it here. But we have hats, specie hats. So these go under the toilet, and we include 2. So there's a solid one to measure fluid loss, and then it fits inside this one with holes. And we have these made so that it can act as a strainer, and this helps catch baby or any tissue, and they can still measure their fluid loss should they need to communicate that with their provider. And then a chuck pad at the bottom. So that is everything that is included in our miscarriage kit.
Wow,
Thank you.
so incredible. Everything is so thoughtfully curated and simple and not overwhelming. So I'm just so, so grateful for these kits and that they exist. Thank you so much.
Yeah, thank you for letting me walk through it. I appreciate that.
Absolutely. Yeah, with all the Instagram comments, what's in the kit? What's in the kit?
I know.
Oh,
And with everything we do, it's so easy to let myself get, because I'm so emotionally tied, to every single piece. But yeah, but we also wanted it to have both components, caring for the full person, knowing that they're going through something really hard. But then the practicality is that they need to also have those information and tools.
yeah,
Yeah.
absolutely. Absolutely. So good. Okay. Well, we're going to close this out with talking more about practical tools to really help close the gap. So these are going to be more for the clinical or professional setting. Um, and so let's start with language. So don't say anything that starts with at least. At least you were early. At least this, at least that. No, thank you. helpful. Something that is just always welcome and always safe is I'm so sorry for your loss. Everything happens for a reason. No, not helpful for mamas. Um, Something else you can say is take your time. There's no right way to grieve this. He or she is in a better place now. Whew, that's a tough one to hear. You can say something like their life, however brief, deeply mattered. I just can't imagine. That's also can be kind of hard for somebody to hear. So you can say something like it makes sense that this hurts so deeply because you loved so deeply. Oh, this will make you stronger. You can try again. Time heals all wounds. Well, be grateful. Be grateful that you have one living child. Be grateful that fill in the blank. Nothing like that is helpful. So, other things that you can say, you don't have to make meaning out of this right now. Some things are just heartbreakingly unfair. I wish I could take the pain away, but I'm with you every step. And something about else, if you want to help open the conversation, is when you want to tell me about them, your baby, or your experience, I'm listening. All right. So supporting sorrows. This is more so for general support that you can offer, not just in the clinical setting, but helping to show up and remember with mom. So continuing to show up for months and years after loss, remembering those dates, whether it's a due date or a birth date or a heaven date, that is something that you can pop in your phone to remind you to just acknowledge. If they name their baby, mentioning their baby honestly means the world. Hey, I saw this candle and it made me think of your sweet baby Josie or whatever the baby's name is, right? All those things really matter. So trauma-informed care. It looks like when we are delivering the hardest news to parents, right? Would you like a moment alone or would you like someone to stay with you? Such a great question to ask moms because everybody processes differently. And then reiterating to them in a moment where they feel very out of control, recognizing to them that, hey, I know that this feels really difficult. You are in control of how we move forward, and we can go at your own pace. So we're not rushing decisions, right? We're allowing time to process. Do you want me to go over the next steps now, or do you need a moment? So in our loss literacy training, we go really deep into the trauma brain and what happens during perinatal loss. But to make things short, basically, when people receive this type of news, their higher thinking brain is not turned on. They're in their lower thinking brain. Their emotions, they're flooded with emotions. So they can't absorb the information that they're receiving. So it's nice to, as a provider, say, okay, are you ready to explore and talk about what's next, or do you just need a moment to like process and catch your breath? Um, and then reiterating to them that they have options and that we want to support them in whatever feels right for them and really helping them to make that right educated decision for them. And then after loss and even during loss, it's really important to help bring in community and connection. I think for every single loss mom, what is the most powerful supportive tool is understanding that you're not alone. And it's not just a platitude, oh, you're not alone, this happens all the time. No, I mean actually connecting with other women to really talk through and recognize and read stories and hear other women's stories and woes to be like, okay, I'm really not alone. So that universalism that, okay, this happens. I understand this on a deeper level. There's people who have been through this that are now doing okay. So truly, community is the most healing medicine there is for a lost mom. So those Me Too moments and continued support are really, really important. And so connecting them with support groups, whether that's virtual or in person, and helping them get to retreats or remembrance ceremonies and events can be really, really healing. You guys should reach out to your local hospital. They should be doing a remembrance ceremony, typically in October for Pregnancy and Infant Loss Awareness Month, or even specifically on October 15th. And if there's not something going on, maybe consider starting something. And if you guys have questions about that, I'm happy to help brainstorm what that could look like. Okay, so now we'll dive in a little bit to clinical adjustments. So compassionate clinical language. So if you're a practitioner, we know that unfortunately the terminology is very outdated, needs a facelift to say the least. But there are some very confusing terms that are used that we just need to make sure maybe we filter so that way when we're facing the patient or on the paperwork that the patient's given, there's not any confusion. So something that unfortunately is talked about with spontaneous abortion, which abortion is just a very charged word. We know this, right? In just the world that we live in, it's very charged for good, for bad, everything in between. But it's really confusing for a mama who has a wanted pregnancy that simply miscarried to then get a paper that says spontaneous abortion. And I hear all the time from moms how traumatic that was for them to be like, wait, no, I didn't have an abortion. Or when it shows up on their medical history that there was an abortion in her past. So that's something to look at and to change potentially. So these terms on the left can be damaging, right? Fetal demise. So maybe using a softer language that says like your baby has died, or I'm so sorry, there's no heartbeat. Products of conception. Holy cow. For me, it's so interesting to watch how, we welcome people into the clinic. Oh, we're so excited for you and the baby, the baby, the baby. And then as soon as someone miscarries, it's all of a sudden very clinical and like products of conception. So the best thing to do is to take the lead from mom. What makes you the most comfortable? Would you like to refer to your loss or your baby as products of conception, or does it feel more right to talk about it as pregnancy tissue or your baby? So let mom identify to you what feels right for her. Non-viable pregnancy, something you can say is this pregnancy is not progressing as we hoped. Missed abortion, which is like a missed miscarriage, your body hasn't recognized the loss yet. A lot gentler, softer way of saying that. Complete abortion, okay, all of the pregnancy tissue has passed. Incomplete abortion would be something you could say that's more gentle, is there's still some tissue that your body hasn't naturally passed. Okay, so softening our clinical language is a really, really big for mamas. Now, talking a little bit about clinical adjustments, environmental changes. These are all, by the way, systematic changes that can be made with $0. $0. Like there's no financial investment in any of these changes that we're talking about. So, waiting rooms have an opt-out option of waiting in the main waiting area. So, I just posted a reel that went crazy where mamas were talking about how traumatic it was to sit in the same waiting area with pregnant mamas and newborns when they just got the worst news. So if we can offer a way for moms to either get right back into the exam room or a separate waiting area, or they can just wait in their car and hey, we'll text you when we're ready for you to come in. So giving moms options is really, really helpful. Another thing that you can do is bring in door signs. So maybe it's a butterfly on the door, just something discreet to remind the staff that there's been a pregnancy loss. Okay, something that just knows that, because I have been told so many times where women show up to the clinic and they're like, "Oh, how was baby? Oh, when are you due?" And they're like, "Man, I have to tell the secretary or I have to tell the nurse that I miscarried." Like that just shouldn't happen. We're supposed to be creating a safety environment for these women. So it's important, it's literally our job to know these things, right? So implementing some type of a discrete staff notification system is really helpful. And then just being mindful of the imagery in some of the rooms, right? Like maybe not putting a lost mom in a room with baby pictures and pregnant bellies, right? Maybe some waterfalls or some flowers or something just more calming would be great. And then train staff on inclusive and sensitive language. So, like I was saying, that initial, like, congratulations, oh my gosh, so excited for your baby. Just how are you feeling? How can I support you today? Super simple, right? So that nobody puts their foot in their mouth. Okay, so now getting into a little bit more in depth, there's some system changes. So moms feel super triggered when they have to write, how many births or pregnancies and live births they've had. And that can be kind of jarring. So I was working with some local doulas and we were brainstorming of like, how can they change their intake forms to be a little bit more soft? So we came up with this question. Are there any experiences with pregnancy or loss that feel important for us to be aware of as we care for you? So that allows women to then decide how they want to discuss it, what they want to say. Again, the flagging in the chart system so that all staff knows. Huddles for aligned approach. So if you guys have, okay, on Wednesdays, we have lost moms coming in. Okay, let's remember we have Kenzie coming in. She just had a 12-week loss. She's newly pregnant. So let's really, make sure that we take good care of her, whatever it is, right? So those huddles are really important. And then just generally, the flow needs to definitely be an ultrasound is always first. I can't say how many times I've talked with women who they see the doctor and they're so excited. They're like, "Yay, you're 16 weeks. Yay, you're 20 weeks. We're so excited. And here's the next steps of pregnancy." Then they go to their scan and then they realize that there's no heartbeat. It's really this like whiplash experience. So make sure that the scans are always first and then they see the clinician. Just helps with flow. And then something that I implement when I'm at work is just a 1 minute presence pause. So maybe that's what before you open the office door, just taking a moment to review the chart, recognize what this mama might be feeling, centering yourself, supporting yourself, and then walking through the door and being of service. Okay. Now, education and communication. So always acknowledge first before you dive into anything clinical. We always want to say, "I'm so sorry you're going through this. We will go over steps so you feel as safe and supported as possible at home." And then we talk about the miscarriage kits, which you guys got to see. So we need to educate moms about what to expect. What are the symptoms that they can expect? What should they expect to come out of their body based on gestation? Um, Another thing that I posted online that just went berserk was the fact that so many women are simply told, "Oh, this is just a heavy period." It's not a heavy period. Women were just speaking in depth of like, no, this is legitimate contraction, labor-like experiences. There's clots, there's different things coming out, gestational sacs, things that women were not prepared for. One of my best friends miscarried at 12 weeks and she gave birth to her son and he was intact with all of his 10 fingers and toes. Nobody told her that that could be possible. So it's really important that we empower people. And I know that even talking about this might feel uncomfortable, but that's our job. Like we need to empower women so that they're not surprised. This is already a difficult and traumatic experience for them. And the more that we can let them know what may happen, the less traumatic it is. Trauma happens in the brain when there's surprises, when something happens that they didn't expect. So the more that we can say, you may have this miscarriage may range anywhere from a heavy period to seeing XYZ. And if you see XYZ, these are your options. So you need to be very clear and say, you can bring baby back in a container if you need to flush, if you want to bury baby. All of these options are more than okay. And then obviously having that 24/7 on-call support is so key. So offering resources and legacy items. So trauma can truly blind the desire or the even knowing that they need or want keepsakes or memory items. Oftentimes moms, I hear after the fact, they're like, "Oh, I'm so sad I didn't get footprints," or "I'm so sad that I didn't get that blanket," or "I didn't get that candle," or "that was offered to me." So offering resources and legacy items are huge. So something that I started doing at our hospital is just making a Google Doc of our local resources. So that's something that you can create on your own. It's very simple to do. You start to grab perinatal loss supports, whether it's, pelvic floor specialists, support groups, nonprofits, books, podcasts, perinatal therapists, all of those types of support things. And then I know Kenzie and Held and Hope shared their box, and that's really helpful for the imminent or currently miscarrying mama, right? Who they're actively bleeding, they need educational tools, but more so after moms need a lot of processing and remembrance items. And so there was some confusion when we posted the reel of like, which box is this? So just to be clear, the Held and Hope box is a miscarriage kit. And then we offer, and I know Kenzie also offers after loss, more of the grief and processing boxes. So this is a picture of our Soulful Sorrow boxes. And we also offer guided healing journals and then angel seed garden packets and some really other sweet things that you guys can grab online. Um, yeah, so I just want to say from both Kenzie and I, thank you so much. Whether you are a partner, friend, family, a doula, a nurse, doctor, therapist, or space holder, just thank you so, so much. Your experience is honored both personally and professionally, and we're just so honored that you took the time to really get equipped. And if you're wanting to get more equipped, Soulful Sorrow, we offer a full loss literacy training and education. So we equip communities to move beyond compassion and gain tools, language, and trauma-informed approach that school and society never taught us. So we do offer consulting if you want to start to implement some of these changes in a clinical setting. We offer training and certification. So these are our certifications and CEUs are coming for this, but it's just really nice to be able to show that it's a promise that you are a competent and compassionate, trauma-informed perinatal support for people. Um, and so, yeah, we can open up the floor for some conversation. I'm going to stop sharing now. And we'll go through the chat box if there's anything, but also if you guys would like to unmute, feel free.
Hey guys, Hillary,
Hi.
Lauren, hi. Nice to see you live, not just on social media. And hey, Kenzie, I talked to you a little while ago. Um,
Yeah.
so yeah, my manager had to pop off, but I presented you gave me some samples, so I presented them to her. And I'm just kind of curious from you guys if there's any like common questions or pushback you've received from hospital systems or doctors' offices that they ask you when you've gone to have these conversations, just in preparation to have these conversations with my hospital and then I'm gonna try to bring them to my local hospitals too. So just curious about that.
Well, I know for us, thankfully, we've been very well received. I'm incredibly thankful for that. But we did have a few doctors that we spoke with, and our only pushback was that they thought they were doing enough. They said we talked to them in office, and we're feeling pretty good about what we offer. That was kind of hard because we know that counsel in office, even if it's excellent, as Lauren talked about, the brain can only take in so much in the moment. So I think that we just have some work to do, maybe continue to work with those doctors. But that's the only pushback we've had. How about you, Lauren? Anything?
Awesome.
Yeah, I had heard a little pushback about the kits being quote unquote, like literally direct quote, too much. Like it was too, I was like, too much what? Too much support, too much. And they were like, well,
Right.
everybody is in different stages of loss and it's not applicable for everyone. And I was just thinking like, well, it's great to offer something versus nothing.
Right.
Um, and so I think
Right.
from a clinical standpoint, just kind of bringing home the fact that, yeah, women need tools at home to
Mhm.
really recognize what's normal, what's not normal, and what they're going to expect. And that's where those kits are just so comprehensive. And if you can get your hands on a kit to
Yeah.
actually physically show what it looks like and what's included, that's really helpful.
Yeah.
Yeah.
Awesome.
And also, one thing is that we do point out to when it comes to working with doctors and nurses is that it fits into their existing workflow. It's not adding, but also what it
Yeah.
does add is to their care surveys, their patient care surveys. And when they see these women back, because gosh, the statistic is going to fail me now, but these women oftentimes they're going to end up back in the office with a pregnancy later and they're going to look them in the face and know if they provided them care or not. And well, if they choose to go back to that, that doctor at all.
Yeah.
But the ability for them to give quality care while not having to increase their workload, doctors
Yeah.
seemed to click. Like, okay, that's right.
Yeah.
And also it decreases calls back, because these women are like, I don't know, what do I
Yeah.
do? So they continually call, they get the chart messages, not to discourage that. I think women absolutely should call, should they feel the need to,
Yeah.
but it does work in their favor. It's not some extra work for them. All the way around, it works in their favor.
Hmm.
Yeah. Those are really good points to keep in mind to
Yeah.
remind them too. Yeah. And I just wanted to say thank you to you guys. This was so helpful. And it's so nice that you recorded it because I can reference those, just that slide on the last one about the trauma. I'm just realizing like, wow, we are traumatizing patients every day and not realizing it by just all these little things that I experienced as a patient too. But it's just how many patients a day do we like non-intentionally traumatize and make things way worse than they already are? It's just like the opposite of what we want to do in healthcare. So this is so good. And then my only other question was, are the most common places that in cl like clinically that are using them mainly like emergency rooms and then OB/GYN offices outpatient that you guys have seen, besides like all the other places you listed?
Yeah, I would say emergency departments have been probably more so than the OB/GYN offices. I've been hearing that
Yeah,
OB/GYNs are typically seeing patients later, at
yeah,
12 weeks and up. So a lot of times we're hearing that these women are presenting in the emergency departments at higher rates. I don't know if
yeah,
that's just with the places we've talked to. So a lot more kids have been going into the emergency departments.
yeah,
We still do work with OB/GYNs, but it's not, sometimes it just doesn't fit as well because of the gestational ages that they're seeing their patients. So, yeah.
yeah. That makes sense. Awesome. Well, thank you guys so much for doing this. I just wanted to say thanks. It was amazing and very, very helpful. So thank you.
Yeah, this is great to put a face to the
Yeah.
name
I
too.
know. Like, yeah. Thanks. Really appreciate it.
Absolutely. And thank you, Becca. I saw your chat there. Glad that this was helpful.
Yeah.
I don't think my camera's working. Not real sure about that. But I'm Christy Lamarck from St. Tammany Health System. We just got our kits and we're excited.
Yay.
Um, Question I had for you guys is, will you share the PowerPoint with us?
Oh, yeah. Can we? Yep.
Yeah,
Just because I would like to be able to, I was writing feverishly, but some of the data that you had, I'd love to share that. And we've been working on some legislation here in Louisiana, and I'd love to be able to talk to some of our politicians about that too.
amazing. Yeah, Christy, we can chat. Some of the slides are trademarked for loss literacy training, so I'll look into what that looks like.
Okay,
Yeah, happy
perfect.
with the info though.
Absolutely. Thank you.
Yeah. All right. Well, thank you guys so much. Anything in closing, Kenzie, that you want to say or that we missed?
Goodness, just everyone here knows that there's so much work to be done in this area, but seeing just all of your faces here today and seeing the work that you're doing, and together, I really do believe that we are making a difference. Um, and yeah, this is just really powerful. All of us coming together and everyone that'll watch this and implementing these things, these changes in language, even if it's not with the kids, well, we do hope, to reach women with our kids. All of these steps are so crucial. And I'm just really hopeful for the outcome from all of this. Yeah.
Yeah. Yes. Thank you guys so much for being here. And if you guys have any questions or need anything, Kenzie and I are always available via email or social media. So thank you guys so much,
All right. Wonderful. Thank you.
guys.